The Lassa fever outbreak in 2012 was described as the peak of the disease in Nigeria, since it was first identified in Borno State, northeast Nigeria, in 1969. 1,800 suspected cases were recorded then, with 70 deaths. But at the end of the late 2015-2016 outbreak, the number of fatalities was higher than that of 2012 at 101, even though the number of cases dropped significantly. This was attributed to failure of the surveillance system.
As at last week, we had 19 confirmed or probable cases. This week, we are up to 26. So there's an increasing trickle of cases. Luckily, we don't have a large outbreak like we had last year, and that means we're getting better at detecting cases early and responding to cases. The initial transmission of Lassa is often from rats to humans, but then the large outbreaks are actually caused by human-to-human transmission. So what we're getting a lot better, and which is our message this year, is that once you see a case of fever, do your rapid diagnostic test for malaria. If that patient is not getting better, don't continue treating and looking. You have to start thinking about other options, other causes of fever. And one of those during the dry season is Lassa.
Indeed, for everyone in every part of Nigeria, Lassa fever awareness and control should be a public health duty.
These days, we will advise you to keep your gari in a very good containers, covered containers.
When the rodents get in touch with human food items like the grains, and it excretes there, and some of these, when they even dry up, through inhalation, a man can get this virus, or by ingestion of these contaminated food items. If you have holes through which rodents can come into the house, make sure you block everything. And then personal hygiene. And then when you say personal hygiene, make sure you wash your hands. At the same time, food hygiene. And we keep our grains in a place where rats cannot easily have access to them.
While avoiding rat-to-human contact is important, the transmission of the disease from person to person must also be curbed.
The most important point about management of Lassa is around the use of what we call universal precautions. Now, these are gloves, face masks in treating. In Sierra Leone, the awareness of Lassa is so high that people actually use gloves at home. And we are actually saying that in Nigeria, we need to actually start using it in hospitals. Now, this might seem like a no-brainer, but the truth is that we are not doing enough of it. So we are very careless generally in many of our clinical settings when patients come in not to use gloves, and then we wait for a diagnosis of Lassa to happen, and then we start looking for gloves. Then, just like in Sierra Leone, we should also start increasing awareness among Nigerians to use it in our homes. If we have a family member that is ill, you might be saving that person and saving yourself by putting on a pair of gloves when you're managing her or dealing with the vomit or whatever you're doing.
The prevention of Lassa fever revolves around a clean environment coupled with good food and personal hygiene. Also, nipping the virus in the bud means knowing the symptoms of the disease and reporting same to the health center. Yomi Otaigbe reporting for Channels Television News.